This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. For a man who has been through prostate cancer treatment, there is perhaps no number more watched or more feared than the PSA. After a successful surgery or radiation course, you want to see that number stay at 0 or close to it. But what happens when it starts to rise again? For many men, this moment, known as a biochemical recurrence, can feel like a devastating setback. But I am here to tell you that it is not the end of the story. In fact, for many, it is a critical second chance for a cure. The science of how we manage recurrent prostate cancer has evolved dramatically, moving from a reactive approach to a proactive, highly personalized strategy guided by advanced imaging and a deep understanding of risk. Today, we will explore this modern paradigm of salvage therapy, a field dedicated to giving men the best possible shot at long-term cancer-free survival. So what exactly is salvage therapy? It is a treatment, such as radiation or surgery, that is given after an initial, curative intent therapy has failed to eliminate all the cancer. This failure is most often detected not by a physical symptom or a visible tumor on a scan, but by a rising prostate-specific antigen, or PSA level. This is called a biochemical recurrence. After a radical prostatectomy, a BCR is typically defined as a PSA level of 0.2 ng/mL or higher, with a second confirmatory rise. After radiation therapy, it's defined by the Phoenix criteria, a rise of 2 ng/mL or more above the lowest PSA point. This rising PSA is a crucial signal that some cancer cells have survived and are starting to grow again, somewhere in the body. The goal of salvage therapy is to find and destroy these remaining cells before they have a chance to spread further. The mechanism behind salvage therapy depends on the initial treatment. If a man had surgery to remove his prostate, the recurrence is often microscopic disease left behind in the prostate bed, the area where the prostate used to be. In this case, salvage therapy works by using highly focused radiation to sterilize that area and eradicate those residual cells. In some cases, we combine radiation with androgen deprivation therapy, or ADT, which is a form of hormone therapy that lowers testosterone levels to make the cancer cells more vulnerable to the radiation. If the initial treatment was radiation, salvage therapy involves a local treatment to destroy the tumor within the prostate, such as a salvage radical prostatectomy to remove the prostate, or a focal ablation technique like cryotherapy or high-intensity focused ultrasound, HIFU. This modern approach to salvage therapy is a major evolution in prostate cancer care, as codified in the 2024 AUA, ASTRO, and SUO guideline. The most critical evidence-based principle is that for men with a recurrence after surgery, salvage radiation is far more effective when given early at lower PSA levels. This is a strong recommendation based on multiple studies showing that early intervention leads to better cancer control and even improved survival. The guideline now recommends initiating salvage radiation when the PSA is at or below 0.5 ng/mL. A second major breakthrough has been the integration of next-generation imaging, specifically PSMA PET scans, which are much more sensitive than conventional CT and bone scans for detecting where the cancer has recurred. So why isn't this proactive approach universally known and applied? One reason is that the concept of biochemical recurrence can be confusing, and the window for optimal treatment is narrow. There can be a tendency to watch and wait as the PSA slowly rises, but the evidence is clear that waiting too long can compromise the effectiveness of salvage therapy. Another barrier is access to new technology. PSMA PET scans, while revolutionary, are not yet available everywhere, which can lead to disparities in care. Finally, there is the understandable fear of undergoing more treatment and facing another round of potential side effects impacting urinary, bowel, and sexual function. This requires a deep, shared decision-making conversation about the risks of treatment versus the risks of the cancer progressing. The patient experience on a salvage therapy pathway is a highly monitored and proactive one. For a man with a BCR after surgery, it typically starts with tracking his PSA, often with ultrasensitive tests that can detect a rise even before it reaches the 0.2 threshold. He will then undergo a PSMA PET scan to locate any sites of recurrence. Based on these findings, he may undergo a course of salvage radiation, which usually involves daily treatments over several weeks. If he has high-risk features, this will likely be combined with hormone therapy injections for a period of 4 to 24 months. For a man with a recurrence after primary radiation, the experience involves a prostate biopsy to confirm the cancer is still localized, followed by a major salvage surgery or ablation. Personalized urologic care is at the absolute heart of modern salvage therapy. After surgery, the decision to add hormone therapy to radiation, and for how long, is personalized based on a man's specific risk factors. A man with a low PSA and favorable pathology might receive radiation alone. A man with a higher Gleason score, a rapidly doubling PSA, or positive findings on his PET scan would be offered ADT with his radiation. This personalization extends to the radiation field itself. If the PET scan shows cancer in the pelvic lymph nodes, the radiation field will be expanded to treat those areas. This allows us to tailor the intensity of treatment to the aggressiveness of the disease. When applied correctly, this personalized approach is incredibly effective. 3 major randomized clinical trials, GETUG FU16, RTOG 9601, and SPORT, have all shown that for high-risk patients, adding ADT to salvage radiation improves outcomes, including progression-free and metastasis-free survival. The RTOG 9601 trial even showed an improvement in 12-year overall survival for the men who received combination therapy. More recently, new strategies are emerging for men with oligometastatic disease, where a PET scan detects just a few spots of cancer that have spread. For these men, treating the individual spots with highly focused radiation, a technique called SABR, has been shown in randomized trials to significantly delay the need for lifelong hormone therapy. The future of salvage therapy is moving toward even greater precision. New tissue-based genomic classifiers can analyze a man's original prostatectomy specimen to better predict his risk of recurrence, and may one day help us identify who will benefit most from intensified treatments like ADT. Clinical trials are also underway testing even newer, more potent hormone therapies in the salvage setting to see if we can further improve outcomes for high-risk men. As our imaging and molecular understanding of prostate cancer improves, our ability to deliver the right treatment to the right patient at the right time will only get better. I do this work because I want to give men a message of hope. A rising PSA after initial treatment is not a failure. It is a signal and an opportunity. It is a second chance to achieve a cure. The better way forward is not to watch and wait in fear, but to act decisively, guided by the best evidence and the most advanced technology we have. It's about a partnership between the patient and a multidisciplinary team to create a personalized plan that aggressively targets the cancer while thoughtfully considering the impact on quality of life. By embracing this proactive, intelligent approach to salvage therapy, we can turn a moment of anxiety into a durable, long-term victory over prostate cancer. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.